Hi everyone, welcome to researchmd.com. This is Dr. Pramil. I work as a Chief Medical Officer and I'm also an Associate Professor of Medicine in one of the large medical schools in the United States. So we're going to continue our series of video presentations on herbal medicine and its complications. And again, wanted to make sure our purpose is not to put the herbal medication down, but it's to educate people about some of the side effects. Like every drug we take, even allopathic, doesn't matter, herbal have some complications, but it's important for the people who's taking it and the physicians prescribing it also to make sure what kind of complications you can expect. Okay, that's the whole purpose. Again, herbal medicine have tremendous potential, but it can also cause complications. So let's proceed with our presentation. Today our presentation is a very famous drug called Ashwagandha. Okay, it's actually described very well in Indian literature, the old ancient Indian literature. If you look at it's a Sanskrit word, right? Ashwagandha, Ashwa means horse and Gandha means smell, the smell of the horse. Just like a horse, it gives you like a lot of rejuvenating power. It was actually described one of the ancient Ayurvedic texts called the Charaka Samhita, the beneficial properties of this drug called Ashwagandha. Okay. Now let's look at what are the components in the ashwagandha kind of causing the effects and the complications. Okay, you need to know the first one is vithanolide glycoside and vithanolide A-glycone. Those are the two components actually is causing all the effects and all the complications also. Okay. Now, let's look at what are the beneficial effects first. The beneficial effects are so many, tremendous potential. Anti-anxiolytic, antioxidant, anti-cancer properties, treatment for like lupus, rheumatoid arthritis, so many properties. Maybe we'll do a presentation later on the beneficial effects of ashwagandha. Okay. Now let's look at our, so what we did, like the next thing is we reviewed the scientific literature and all our presentation based on pure science. So what we find looking at the complications. Okay, the first one was published in the Pharmacology Journal, Safety and Clinical Effectiveness of Withania actually, somnifera. That's the clinical name of the ashwagandha. Okay, Withania somnifera. They did look at 65 clinical studies and they came up with what are the complications you can expect. Okay, that's given in this slide. We got mainly the usual complications are like mild, or they are like gastrointestinal complications. You can have nausea, vomiting, constipation. You can have rhinitis, cough. You can have nocturnal cramps, weight gain, decreased appetite, and hyperactivity, hyperacidity. Those are the main complications they found in this study. Okay. Now let's look at the next study. Is also a unique study. They looked at it was published in the Journal of Ayurvedic Medicine, and it was an exploratory study and very interesting finding. One of the lab values kind of concerning. Serum creatinine after taking this drug has gone up a little bit. Okay, not much. Again, it can cause increased creatinine, which is our renal function test, can tell you about how kidneys are working. Okay, it also increased the uric acid level. Now, so let's look at some case reports like what they published. The first one is about a case report about liver toxicity, and then there was a case series came from Iceland. There were about 5 people. Majority of the male developed liver toxicity after taking ashwagandha. Fortunately, after stopping the drug and all of that effects had gone up, patient developed jaundice, itching. We call this cholestatic jaundice picture. That's what they developed. Okay. The next study was, again, it's very important, I think, the next case report. It was about a patient, a 66-year-old, developed thyrotoxicosis. And this patient was taking around 1950 milligram of Ashwagandha, which is a very high dose. And Ashwagandha, you need to know, it can increase your thyroid function test. Okay, it can increase TSH, increase free T4, free T3. So if you have to be very careful. If you are already like hyperthyroidism, you have to be very careful before you take the drug. Okay, in this patient with the thyrotoxicosis picture, the symptoms usually palpitations, diarrhea, sweating, those kind of symptoms patient presented with. Next case report about patient, a 47-year-old patient is actually female, presented with adrenal hypofunction. That means after taking this drug, adrenal hormones are gone down, especially the cortisol level. Okay. The next case report about a patient, very important again, patient had kidney transplant. After taking this drug, Ashwagandha, they went into kidney transplant rejection. So if you have any type of transplant, please do not take this drug. Okay, it's very it is dangerous. I mean, you can have rejection and you might lose your kidney or whichever organ you're going to transplant it. The next case report about a patient who was after taking this drug, have drug eruptions, kind of skin changes, plaque, itching. We call this a drug eruption after taking this drug. Okay, and the last one I want to know is about this drug can cause abortion. So if you're pregnant, please do not take this drug, and it can cause abortions. Okay, so thank you so much for watching our presentation. We'll be back with another presentation soon. Please help us by subscribing to the channel. Your support is very important, so we can continue to making presentations like that. God bless. Thank you.